Hi, everybody. Welcome, welcome, welcome. I'm really excited to have everybody here today and to have this discussion. Let me share my screen. For those who don't know me or don't get any of the hundreds of emails that are sent out in my name every day, my name is Tim Oppenheim. I'm the Chief Information Officer from the National Head Start Association. And I really apologize that we should have been talking about this um, for a while now. And just between everything that happens in the world, um, you know, we have it and stuff. So we really want to get this conversation rolling. I think we got a pretty good lineup of work today and stuff. So let me just kind of get the ball rolling, give you some context and stuff. I was really hoping that I'm glad that we have such a large group and stuff. I was really hoping that we could really share some things and make really good use of the chat function within Zoom. So if something comes up or there's a discussion or whatever, I really hope that you put some notes or questions in Zoom and in the Zoom chat. And what we'll try to do is we'll try to address those as soon as we can and try to make it valuable and stuff. Here's the agenda. We're going to try to keep this to a solid hour. We have some folks with us to join us and kind of talk about these things and really kind of get the ball rolling the way we look at it. What's fun, when we talk about AI, I feel like an old guy a lot of times and stuff. I feel like, when I was a buggy whip maker and stuff, and then the Model T comes out and all these people are driving cars. I think I really wanted to wait till the Teslas were ready. So I have my own kind of stumbling blocks around AI, how I use them personally and stuff. But I'll grow with Head Start. How's that? One of the fun things that I did was actually use Claude to build this slide deck. And so this slide deck is not going to look like the normal NHSA ones, which are always beautiful, and we have some fantastic staff that put those together. This one was done by Claude. So that's part of this discussion. So let's get going with a quick demonstration by our guest here. And I have misspelled Andre's name on here and stuff. Andre, if you will take it away and share your screen.
Sure will. Let me share my screen first just to make sure we're good. This will stop sharing your screen. All right, I think you all can see my screen now. Tim, can you just confirm that you can see my screen?
Yes, good to go.
Great, appreciate it. Pleasure to meet you all, everybody. I'm Andre Parrott. I'm the Chief Executive Officer at Untapped Solutions. Just quick overview because I'm on a 10-minute timer here. We are a case management CRM and workforce platform. We work directly with nonprofits and what we consider client-driven organizations. So if you serve people, then we like to serve you, right? That our mission is to serve those who serve others. So we're a company that comes in to provide CRM case management or AI technology that helps you move your mission forward. I'm going to go through a couple of things in this demo environment today to show you a couple of use cases on how AI can sort of work using your data that's inside your CRM and all these different kind of stuff today. So I'm sure Tim will share all this too with you afterwards, and we'll have some time for questions, team. So this is all mock data, team. These are fake clients, fake individuals. Again, I'm going to go through a couple of use cases. So as you can see, I'm on a screen. I'm a social worker pretending to be one today. That's what I am by trade before doing this work. So as I have a couple of different clients on the screen here, such as Marcus, you can notice that as I click on view, Marcus is a regular individual, right? Actually, I'm going to click on edit. I have Marcus's general information, all the information that you guys have in your CRM, such as their barriers, their justice impacted, do they have mental health conditions, any substance abuse conditions, right? These are all the things you guys are all putting in your CRM all day. And I want to show you how AI can use this to help you guys move your work faster and do less as caseworkers and nonprofit professionals. So as you can see, I added a lot of different things inside their profile. I would exit this out. In real life, you guys probably would have saved this. And now we want to help this client, Marcus. We want to get them jobs. We want to get them services. We want to build a resume. We want to do all these things for this client. How does AI help us do these things without leaving our desk in 2026? So one of the first tools we're going to go over is the AI can make referrals automatically for you, right? These are the things we do as nonprofit professionals. I want to click on refer. and show that in Untapped Solutions or in different AI tools, you are able to refer your client directly to jobs. So as you can see, I'm looking at Marcus Johnson. This is a job at Amazon warehouse. This is a real job. And it was able to let me know that whether he has a conviction or not, this is still a good fit. He has two skills that match. What's two transferable skills? This means these are things that are not traditionally listed as skills. He may have, came clean from drugs, got out of prison and changed his life. What does it take to come clean from drugs? What does it take to change your life? What does it take to rob a bank or to sell drugs? Selling drugs, you probably have sales skills. Our system can help you identify that, right? AI can say, well, since they sold drugs, they should probably be looking at sales jobs. And that's what it's telling you, right? When you look at transferable skills. So when you see skill matching, we know what that is. Transferable is those other things that don't look like skills. And then AI helping you do the things you're going to think of. Is this a good fit? Yeah, this banned the box employer doesn't care about their record anymore. Housing instability. This employer doesn't care if they use a transitional housing address. Well, this client also has substance abuse. Well, they have a partnership with recovery support organizations. This seems like a good fit for my job, for my client. How long would this have took us, team? These are the things that AI is doing autonomously for us. Even when it comes to services, not just jobs, but hey, this client is listed as in crisis. They don't have a house. What am I going to do? Try to search all these different databases for housing organizations, shelters, when Untap and different AI tools, we can find housing for individuals. Rapid rehousing program, it found it. I can refer my client, and now that's done autonomously, right? So you have things such as job referrals. You have things that AI can find services and support clients for you and all these different kind of things. But you also have other stuff like resume builder. All of us build resumes for our clients. And if we don't, we have partners that do. But when it comes to building resumes and doing all that kind of stuff, AI is also here, right? Where you can type sentences, right? Again, whatever your client's been through. So I can come in here and type, my client was a survivor of domestic violence. She relocated herself and rebuilt her life. What skills does it take for you to be a survivor of domestic violence, rebuild your life, relocate? And as I'm typing those things in, right? Community crew leadership, anything here, it's taking that and bringing it into a resume for me. So now I can click autofill and my resume is auto-filled off just sentences that I wrote about my client's life. So their professional summaries is pre-filled, their work experience is going to be pre-filled, their education is going to be pre-filled. So I'm, again, not building resumes in real time. I'm using AI to build a resume directly for me. And then I can preview the resume directly here. This is a demo, so there's not going to be anything, but I can preview to say, hey, this looks great, or I can keep coming and adding to this resume or using AI to autofill the resume based off different things that I want to see. One of the things that I know Tim wants me to talk about here too as well is coming into AI social workers. So how can AI social workers, AI caseworkers, things that help our clients? So another cool thing we're doing here is you can deploy AI to your client's phone. So our clients need jobs, they need to renew healthcare, they need housing, they need a lot of things, sometimes past the times that we work. So I'm able to come in here, deploy the app to my client, click this button, and I'm going to click the sign out button here. And as you send your app to your client, what does it look like for the clients now? So this is what it looks like for when clients are coming in. What can AI do for the community? Right? As I come in here, I can come in and click services. And what has AI did? It read everything in your CRM, all the barriers. Andre needs food support, he needs housing, all these different things. So now the services that are near me, Untapped Solutions can pre-fill intake for me. So it can pre-fill the intake form for me based off that. And now all I have to do is click apply, and I'm able to apply these support services automatically. But other than that, remember, I didn't have to look for these additional services. The AI found it for me. The AI can also take these different jobs that Untapped Solutions has partnerships with, and it can analyze if the job is a good fit based on whether I have a conviction, whether I just got clean from drugs, maybe I don't have transportation. Doesn't really matter. Any scenario, it can say if this is going to be a life fit, right? We don't do a skill fit. We like to say, is this a life fit for the client and all that kind of good stuff. So AI is in here not just building resumes or helping you move the needle, but your clients have access to come in here and have AI move the needle for them, whether it's access to jobs, access to services, renewing healthcare, renewing resumes. All of this can happen autonomously inside the app. As I log back out to come back into other different kind of things that we have here, But these things that I showed you across here when it comes to client and cases, these are again really things like us on the front line working directly with clients are going to do when it comes to automatic referrals, AI resumes, all that kind of stuff. But then you have other things for different departments. Outreach. How do we reach people in our community today? How do we still go outside and ask people? Do we wait for referrals? When we realize we're in 2026 and most people who need services, they're on their cell phones. So another thing that AI has been able to do was target people while they're at home on their cell phone. Organizations are able to come inside Untapped Solutions or use one of our AI plugins, take all their services, whether you offer workforce development, IT, whatever you offer to your community. As soon as you post it, AI can then take your service. It knows your requirements. You want 18 to 24 females who have this kind of background, and then it will find those people and bring them directly to you. So now that I posted my service, AI has went out in the community via cell phones and brought me back people that meet those needs that want my services, such as Marcus, such as David Chang, such as Jerome Mitchell. So when we think of this, what is this replacing? What is this assisting? Outreach, how we do outreach, and it's assisting outreach specialists in the nonprofit sector find the people that we want. Also, AI can grab referrals. AI this day can go out in the neighborhood and go to nonprofit CRMs and bring different referrals to as well. So that way you can get referrals from Angela, who works at Brooklyn Works, autonomously and track your updates and not have to do an email referral these days. So it's doing a lot of AI is doing a lot of different things. When we leave out of this sector of frontline work and go into like more of the exec reporting role, you also have AI that's helping people make better reports for funders these days. Reports that don't just come through in an Excel spreadsheet with numbers, but reports that show the numbers but tell the story. So this AI tool here is showing me an impact feed. So me as a chief program officer, the executive director, I'm in here and I'm looking at reports differently. I don't just see the numbers, but what I see is individual stories, or I can look at program stories for a whole program. So I can come in here and say, I want a new story, and I may want to generate one. I want it based off my healthcare program, or I want a story on a specific client. And then I can see that a 34-year-old father completed the IT certification track. This improved their household $18,000. And in this zip code that he's from, there's this big problem still happening there that I think this data is telling me that my organization can tackle more people there. We can do a lot more there, but here's some success. So I'm able to go down and automatically have AI generate these unique stories for my funders and then send these to my funders autonomously. So this can make it and then send it autonomously, or I can just build these different unique kind of stories. Tim, what am I on? Where am I at on time?
You're getting close.
Okay, good. Thank you. Going back into the last thing, when it comes to untapped intelligence, just different things. Again, generating case plans team, building resumes, finding resources, generate case plans. Those are things that AI can do to make sure we actually personalize everybody's case plan. We don't let a person answer a couple of questions and then say, hey, you fit this kind of case plan. We can actually have AI look at this unique barriers of this unique person and then generate a unique case plan for that person.
Wow.
When it comes to reports, last thing I'll cover is AI can also build reports, right? We're not in the stage where we need to do things manual anymore, have a hard time building complex reports. AI is able to give you templates already or build one autonomously for you directly in the platform by you just typing what you want and then previewing your reports. That's been a hard thing that I had to do at my nonprofit background. It's still a hard thing today. So again, team, quick overview from AI can automate referrals for you. AI can build resumes for you. It can build case plans for you. It's not here to replace nonprofit work because it can't provide empathy to the clients like we have to provide empathy and love here. But what it can do is stop us from doing the things we've been doing manual for 50 years, because we can serve more people that way. And if we can serve more people, all those numbers we care about from homeless recidivism can actually get lowered because our time is not spent servicing the same amount of people every year. So that's our goal for what AI can do in the sector. And I'll pause here, Tim, to pass it back to you.
Wow. Thank you so much, Andre. So, my what my goal here was with bringing Andre here and stuff is that there's really not an app built on AI within the Head Start community and stuff. And so when I reached out to our kind of network of friends around social services, which is a lot like Head Start, I found Andre, and Andre was generous enough to come up here and talk about how his particular product does meet this kind of need and stuff. And I think that's when we talk about AI. I think that's a good opportunity for Head Start to have these kinds of products out there, or that, let's call them AI enhanced products and stuff like that. So, Courtney, I'm sorry, I forgot to launch the poll on the first thing. Can you launch that first poll? So there is a quick poll that we want to do here just to get a kind of, just kind of figure out where everybody is as we, start and anticipate this community. We want to talk about what's available, what should be available. Is there a need for more training out there? Do we need to train on specific platforms? Is there ways that we can, as the national organization, kind of influence some of these organizations to make it more Head Start centric? There's also, I saw in the chat when I was just kind of looking through their stuff, what are your security concerns? And then how are these chat companies addressing those concerns? How can we do this? How can we shape this conversation? I think if you scroll down on these, there's 3 questions. We can see the polls. I think now is really the time to kind of dive deep into this, what our community, what the Head Start community needs, and what these providers literally should be providing. And so that was my goal here with this and stuff. So I see on here and stuff that the most people are using ChatGPT. We at NHSA are using Claude. No Grok users, shocking. Gemini, which is kind of built into to Google products, and Copilot, which is built into Microsoft products. And for I see that quite a few are building reports and stuff like that. On the something else, if you're using an AI tool for something else, it would be really good if to put that answer in the chat box so we can kind of look at it and see if you're going for it and stuff. And then it looks like the vast majority of people that answered are not paying for it. And that kind of skews to things to adoption and the use of this and stuff. So I want to thank everybody for sharing that. I mean, we're going to have, hopefully this is just the very kickoff of much longer conversations and stuff like that. So next on our agenda was Dr. Greg Dixon. Greg is formerly of Acorn Analytics, and he's now joined the team at NHSA as our Chief Research Officer. And when I was discussing this seminar and stuff, I had asked him about, some of these advanced use cases, like what are you doing now? And he had some great answers to that. Greg, you want to take it away?
I'd be happy to, Tim. Thanks for the opportunity. Thanks for having me in for this. I'm always happy to talk about these kind of things. What we've seen here is an example of how AI embedded in a platform can help save you a lot of time and effort by directing you into the different kinds of things you want to do. I'm going to talk about something that's a little bit different, which is the use of large language models like ChatGPT to save time and to engage with things that might have taken quite a bit of time in the past that you can do a good enough version of right now. I want to start off by differentiating a large language model from some of the other things that are out there. When you ask ChatGPT or Gemini or any of these other platforms a question, they're basically going to take your prompt, whatever you've entered as the prompt, and go basically say, if I asked 3 million internet users to answer this question, what would kind of the average answer look like? So anytime you're going to use these platforms, you have to basically think ahead of time about what it is that you're doing and what that prompt is going to look like. And what that's going to mean in Head Start programs is there's some incredibly useful stuff that you can get out of it. There's also things you just can't do because it would involve sharing information with the platform that you can't share. Anything that you input into that platform goes into the training. If you're using a free account, absolutely everything you do goes into the training systems, which means it's shared on the back end and becomes part of what the platform will use. Most paid versions still your data is going to be used for training purposes. So you can never include personally identifiable information that's FERPA or HIPAA related into these things at all. There was one of the big questions that was coming up here about what's the ethics of doing this. As long as you are remembering what these are doing, and as long as you remember what they're going to give you as a response, these can be really useful tools. But you do always have to have in the back of your mind that you're basically polling 3 million internet users, general internet users, not Head Start users, not people in Head Start programs, not social service workers, just average folks. So most of the time, what you're looking at with these are starting points. I don't want to take the time to go Google and look at 100 websites, but I just want to see what those 100 websites would tell me. Large language models are good at that. And an example of this is I need an icebreaker for an upcoming training. So you would write a prompt that says, I'm doing a training for 100 people who will be split up into 10 tables of 10 people, and give me an example of 10 icebreakers that I could use to help them get to know each other and become engaged with my material. So your prompt is key here. But if you give a prompt like that, and it will give you 10 prompts, it'll give you 10 responses of 10 icebreakers. 3 of them are going to be just awful and you would never do them because they're terrible. 2 of them are hallucinating and so they're just not useful at all. But 5 of them will actually be good enough that you can look at them and say, these are useful. It's not likely that in a real Head Start program in a meeting like I described, you would use it exactly as it comes out, but you have 5 examples that give you a starting point. So this is the kind of situation where a large language model can be really helpful. You have to do a training in an area that you know lots of these trainings are done. You don't want to start from scratch on what your bullet point outline looks like. Again, you can ask these platforms, give me 5 outlines of the content of a training that fits this description. And you're going to have to give a good, strong description in the prompt for it to do that. And it will give you outlines. And again, at least one of them will be so awful, you will just throw it out right off the bat before you even get rolling through it. And 2 of them are going to be pretty mediocre and you'd feel embarrassed if you gave those trainings. But 2 are decent starts of the trainings. One of the other things you can do with something like that is you put it in Gemini and you put it in ChatGPT and you see the common pieces there. And then you know what the average training like the one you're doing looks like. That doesn't mean you actually want to do that training, but it can save you putting together all of the pieces. It might save you 2 hours, 3 hours of work to start off with that baseline inspiration. And I do this for icebreakers. I do this for in-class activities. I do it with a ton of these things where otherwise I would go look for myself. The AI large language models are good at those things. So I would encourage anybody who has these kinds of activities where you want to be engaging, you want to try something different to get people started and really get hands-on in a meeting, you can get lots of inspiration from that. Because what it's going to do is go look at 3 million people who have talked about icebreakers and tell you 10 examples of the icebreakers that come from that. It's basically a superpowered search engine in that sense. That's really useful, gives you lots of different elements. Large language models are good at that. The cool part about that is you can use that very easily and safely because there's no personally identifiable information. You're not putting any program information in there that is secret or protected or that you don't want to go out into the public. It's easy. You're just asking for general information. Where things get more challenging, and this is really the thing that I think that is new for a lot of Head Start programs, is if you want to understand themes that are buried in open-ended responses. And there was an example in the chat from Liz Bender who said that she had used parent gauge open-ended questions, but stripping out any identifiers. So you just literally have the open text and you use the large language models for this. This can be useful, but you do have to review the information so that you're making sure that nobody entered any personally identifiable information into the open-ended question. So one of the things that sometimes will happen, you look at a family event and you want to look at notes around goals, and it turns out that 10% of them have the child's name typed in the open text. You wouldn't want to submit that data, or you'd want to have a mechanism for removing that data. But if there's no personally identifiable information in there, and what you want to get, let's take a parent gauge open-ended question, Are there 5 themes that emerge from how those questions are answered that would help us better understand the challenges facing our parents today? You can take all of your de-identified responses that are open-ended and you can put them into the large language model, and it will identify themes for you. And what that is doing is it's giving you an idea of all of the things that people are saying based on its understanding of language from going out and looking at all the things people say on the internet. What are the themes that emerge? Now, what you're basically doing there is the equivalent of what we would call content coding in qualitative research. And what you're basically looking for are themes that emerge. And you can do that with humans and have humans read through and look at the open-ended questions and do that. It takes a ton of time and a lot of people. If you need a really good, grounded version of it, qualitative content coding works great. If you just need to have a good idea of the general themes, the large language models will do that for you, and it's much faster. So if you want to get a good general idea and you can ensure that there's no identifiable data in there, these are the kind of things where you can really have advantages. And let's just post in the chat. Followed some of the prompts, and it'll include examples of quotes and supportive evidence from the themes. Prepare an action plan. These are the kind of things where the large language models can be good. One of the things I generally recommend is if you're going to do anything that involves acting or asking for action plans, ask for more than one and compare the answers. Because usually if it just gives you one, you're rolling the dice a little bit. I would also say that it's good, again, critically, that if you know there's no personally identifiable information, being able to put it into like a ChatGPT and a Claude and comparing what they give you as the themes gives you a sense of how the pieces are different. I will usually typically say that it's good to ask for something like 10 themes, and 3 of them will be hallucinations. 7 of them will be good. And looking at it and basically getting a feel for it. You're talking about, I need something that's good enough to give me guidance, not something that I'm going to publish in a journal. So I'm doing good qualitative research methods. This is a big time saver. It can be really useful. I would also argue that the large language models have gotten a lot better at these lately. But one of the things that you would want to do is, if this is something from Parent Gauge, you're talking about families, have a couple family advocates get together and look at your top 7 themes and see if they can identify any hallucinations that you missed. Because you want people to look at this who have good knowledge on the ground and say, like, would you agree that these themes are what you feel from the field? So using large language models to supplement the work that you're already doing and to complement what you're already doing to save you time is a huge area of potential. But you do have to be very careful with this information so that you ensure that you're not giving any personally identifiable information away. If you are asking anything with health, be really careful, because anything that's HIPAA protected, these are not HIPAA compliant devices. But so my 2 examples, how to pick things out for trainings, how to grab things for activities. And you can do this for all different kinds of activities. What's a collection of things that we can do that will help us engage parents in an activity we want to have? Look at the things there. Great. Do I want to see what the themes are? Yes, I'm going to put the themes in there. I've de-identified everything. I've made sure the data is compliant. It's all there. You get themes out of it and you can work with those themes. That's great. The large language models are awesome for that. It saves you an enormous amount of time. I'm a skeptic of the use of AI for a lot of the things people are talking about how it can be used for. But in these areas, we have a lot of work and time that we typically put in, and these can save you that time. They can be very useful for that. But you
Right.
do always want to think about what you are doing. And just because you have a paid account doesn't mean that they're not using your data for training.
Yeah.
If you are interested in using this for anything health related, I would strongly encourage you to poke around. ChatGPT has a particular set of things where they discuss about HIPAA compliant AI. And the minute you start reading that, you will have a very clear understanding that that's not what generally is being done. So be
Yeah.
very careful about picking your subject matter and de-identification, but large language models can be great for saving you time. And a number of the things that people have talked about, I see a lot of you are already doing this for a
Yeah.
lot of areas to help you write emails, to help you put flyers together. anytime I'm putting something that's going to go out into the public, my Dr. Greg research speak version of the summary of it goes into ChatGPT and says, give me 5 normal people versions of what I'm about to say. And it's usually better than what I would have typed up because I'm a nerd and I use nerd speak.
Hey,
So
Greg.
definitely I encourage everyone to work on that. Yeah, Tim.
Thank you very much and stuff. And that's a really good segue to our next little session. And Courtney, can you pop up the next poll? Um, so, you know, where everybody feels really optimistic about these things and stuff, it's what they call AI slop, and it's the errors and the omissions and this kind of deep-seated fear that the information that I am feeding or I'm sharing with these large language models is now going to reproduce or be visible someplace else. Um, and so it's kind of interesting to me, especially when some of the things in Head Start or what we're doing are fairly high stakes. You know, if you're writing an email to parents, or if you're doing so, unless it's like a school activity, but if you're using it for something, you know, that's really kind of important, you know, there's this tendency to get bad information and to really check with it. So, my question to everybody that is using AI tools now, and it looks like we have a pretty good crowd for that, is are you finding errors? Are you finding omissions? Are you finding slop? I had this slide right here where I was going to kind of ask this question about slop and stuff. You know, especially when you're pulling data. Let's say you're writing a report to explain some kind of aspect of Head Start to your board of directors or to your policy council and stuff. Are you pulling data specifically from Head Start Gov? You know, are you pulling data from the performance standards? It's funny. And this is a year ago when I did this. I tried to pull some kind of performance standard data on there and stuff, and it was just dead wrong. The information that was given to me was just dead wrong. I mean, it completely made up stuff. So I do think that the tools are getting better, but I don't know that they're completely perfect yet. And so, as Greg had mentioned, that there is this whole thing about these large language models and what they're doing when you grant it data. You know, in particular, if you're using Claude and you're using you're using some of the access, like if you're using Copilot or Claude with Gmail or Gemini and stuff, that you're granting them access to basically everything. More so than what you may think or may not. NHSA in itself has been kind of reluctant to give it full board access, to give Claude full board access to our systems and stuff, just for this very reason. You know, we put notes in the margins of documents that we may not want to share and stuff like that. So if anybody has any real world experience on that, you know, really like to know. And again, to further this conversation with what's going on. And if you, like I said, if you did found errors, did you notice it early on, or does it after it was already published? You know, was it? And when you found errors, did you scrap and give up and write from scratch, or did you just kind of go onto it and stuff? I have this thing that I think the future of technology is good prompt writers. And I think that's going to be a thing and stuff, especially in Head Start. Whoops, let me see if I can go back over here and stuff. So what I wanted to do, and I think we're a little bit ahead schedule, which is good, because I'm literally the worst talking head. I did want to try to give an example of a real-time code writing thing and stuff. I'm my environment where I'm at in the Head Start communities, I'm in technology and stuff, and so I was going to try to use Claude to build a real-time application that maybe not perfect, but at least, you know, get the ball rolling. So let me see if I can do this. Okay, so I'm gonna go over here and let's see if I can share my screen, stuff like that. Okay, I hope everybody can see this. So I'm typing in here, and I'm in Claude. I'm like, can you just build me a game for a 4-year-old that I can put on a website? And let's just see what happens. Okay, so the first thing that you have to know about writing prompts is you got to be able to spell, which is I should use this prompt for spelling stuff. So this is Claude, and when we asked that question before, how are people using Claude, or how many people are using this and stuff? Claude was not big as name as these other ones and stuff, but I really think that Claude is really pulling ahead here on the way that you do and stuff. So I'm kind of picking of what kind of puzzle or game that we should make or whatever and stuff. So let's just make this little puzzle game for kids. And here it is. This is Claude literally writing the code for this tool right in front of me. So, as a tech guy, this is kind of deeply concerning to me. Anyway, this is about the third one I built, just playing around with this, the tool and stuff like this. So I, like everybody else, my second or third or fourth or fifth iteration of this is going to be really good. But when you talk about the application, people have talked about building surveys and doing all these things and stuff. I don't think it's really beyond the capabilities to do a full, basically Child Plus. Build a whole kind of application on here. I do have a tool right here that I can use to create or upload websites and stuff like that. So let me pop it in here and publish. Whew. Okay, so I gotta find, I hope y'all can see this. Let me fumble around for my browser here, someplace. It's right there. There we go. So let's crank this up. The website is mytinylittle.house.com, which is just my little play one stuff. And there it is. This is what Claude built on here and stuff like that. And I'll put the link in my thing in just a second. So that was literally done in about, I don't know, was that like 2.5 minutes? And when we think about the application of what we can do with these tools, I think that's about as startling an example as I can conjure up. When we talk about this in the context of Head Start, where we're trying to gather information to help families or to build things and stuff, I think this is really kind of an interesting way to go. Combine that with what's already out there in the market. Combine that with what Greg talked about, with kind of taking the tools that we already have and analyzing the data out there, and then going from there. I really think that AI is a very important conversation to be having in the Head Start world right now. Courtney, can you throw up the last poll? So really, the question becomes, we are your let me see if I can get it going.
The poll is up.
Oh, I'm sorry, I don't see it. Okay. So we are your national organization. So the question to ask is like, what do you want to see? What can we use, whatever influence that we have? Can we talk to Head Start, the people that provide services to Head Start? Can we ask them to build in more tools that use AI, much like Andre was showing with his tool that was already, it's already built in. I have seen some tools that are being used in some Head Start programs that are creating some reports. There's ways now that we can automate messaging and stuff, either through text or email. People have built add-ons to tools that, like, when a child's absent or not present, that is automatically creating these texts or these emails for parents. What as a community, what as this group, people either curious about AI or really diving deep in it, what would you like to see? What would you like us to help bring to the community, to the Head Start community and stuff? So that's That's the big question right now. So what's the big picture? So, wow, I whizzed through my hour-long conversation really quickly. I do want to say that um, I think this is really just the opening conversation that NHSA wants to have with our members in the community. So I'm going to throw up some things in the chat and stuff. So we have this group called AI at nhsa.org that we'd love for people to communicate, to send emails, to send use cases. We already have a lot of little communities that are built around data. Greg's addition to the NHSA staff is actually going to enhance that greatly when we talk about using and leveraging the data that we are already generating to make more effective decisions. And so this is just one more step. The little website that I built this little AI tool in here is that, mylittletinyhouse.com, which you're welcome to do. And what I'm asking for everybody that attended is really just to let us know what we can do or how we can move this question around here and stuff. And if anybody has, I did save some time at the end for some question and answer. If anybody wants to put a question in the chat, I'm happy to get Greg or I to answer it. Okay. Well, like I said, this was just the very first round of hopefully a lot of different discussions that we'll have around this, and we definitely want to hear from everybody in the group on what they're doing, what we can do better, what you'd like to know, what kind of tools you'd like to bring to the audience. Yeah, this will be recorded and stuff, and it will actually use the polls and stuff to kind of guide the conversation here in the future. If you want to be part of the discussion, please just send an email to that AI at nhsa.org, and we'll keep you updated there. And then when we do more of these, or when we discuss, I think the big ask that we want to do is these vendors is here's what the NHSA community is wanting from your tools. And so can you help us? So that was a big part of this and stuff. All right. Yeah, real-time referrals. I agree. If I'm pulling the data out here and I can do this in real time, and we can create, one of the problems with referrals and that we want in Head Start is we want the documentation that they occurred. So AI is a good way to do that, to remind the provider or whatever that blah, 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 we need some proof of service or whatever. And I think that's really valuable. Translations, I'm already seeing that. There's a lot there. That is funny about the grants and community assessments. We are seeing a lot of some of the big use cases we've seen for AI is people writing their whole grant application using AI, which kind of led to the question of the AI slop. And so there was a lot of kind of, that was the lead up conversation to this. I'm like, well, I don't know what people are using AI tools for and stuff, but that was one of the big ones to write these grant applications. So on the people that have used AI to write grant applications, I don't know the efficacy of, did the grant get accepted? Did they have to do massive rewrites or whatever? So this is still a story that's still being written. Oh, that's interesting. It did pretty well. That's what we need. All right. Well, to everybody that braved me talking very rapidly for 45 minutes, I want to thank you very much. I want to thank everybody that's really thinking about how to make their lives easier in Head Start and making it making the tools more valuable and more relevant to program staff, to parents, to everybody. Yasmina, my boss, she's always worried that we might be behind. So we need to lead the charge on this. So if people are doing really outrageous things and really cool things with AI, we definitely want to spread the word. All right. Thank you, everybody, and I hope to talk soon.